This real self question is a response to our recent patient who had multiple liposuction done and then a BBL or Brazilian butt lift, which is fat grafting into the buttock. It sounds like the area that was transplanted, was the upper outer part of the cheek, the indentation. Now that's well away from the sitting bone, the butt bone at the high point of the femur. So as long as you sit forward and you're sitting on that what's called the ischial tuberosity or butt bone, and don't put weight on the fat grafting area, you're going to get you're going to de-stress the fat grafts. They do not do well if you're lying on them, if you're putting pressure on them in those first 12 weeks. So in general, you want to be a front or a side sleeper. If it's the upper outer quadrant or indentation of the cheek, make sure that when you're lying on your side, you don't have pressure on it, or sleep on your front. And when you're sitting, sit forward on the chair over the ischial tuberosity or butt bone, it's called. And that should protect your BBL or fat grafting to the buttock. In general, fat grafting to the buttock or Brazilian butt lifting, BBL as it's commonly called as an acronym, should have between 30 and 70% survival of the fat. In general, about 50% survive. So if you had 300 to 330 cc's instilled, in general, on average, 150 to 200 cc's will survive, and you get a nice improvement in the volumization area that was treated. It's a very popular technique. It's very compelling. Stealing from Peter to pay Paul, and you never have to pay Peter back. Take the fat from where you don't want it and stick it where it's going to benefit you. What are the most common areas for fat grafting? Bum, breast, and face.